Welcome to MAP, the bi-weekly market access podcast hosted by me, Dr. Stefan Walzer. I am the innovator of Market Access 4.0 and a health economist by training and working in the fields of market access, reimbursement, pricing, and health economics since 2004. Discover Market Access 4.0 and unveil the future with our innovative solutions. Max Insights, our fast and easy AI-based reimbursement planning platform. Dobo, our new revolutionizing way of creating reimbursement dossiers across the globe with the first and only dossier writing AI bot. Cubo, our new AI-based objection handling platform. And Waffle, train with Waffle's virtual reality genius in an immersive environment and with an AI-based counterpart. We are Market Access 4.0. So check out our website, marketaccess4-0.com. And now let's dive into the current discussions, processes, and trends in market access across the globe. So back to another live kind of session with our podcast series on market access. And today we have, let's say, a very kind of special theme, which is early market access in commercialization planning, which brings, let's say, the business and the market access side together. And for that, we have a great guest. We have Catherine Bacon here, who will speak and discuss, hopefully then also with me around those kind of, let's say, specific items for that topic. Catherine, welcome to the show.
Oh, thank you, Stefan. It's great to have another good chat with you.
Absolutely. So before we maybe jump into the details of the discussion, it would be great if you could just very quickly introduce yourself so that everybody who doesn't know you by now would know you at least after the podcast discussion.
Yeah, so I'm CEO and founder of Fingerpost Consulting Limited, and Fingerpost is a market access and pricing consultancy. Personally, I've been working in market access for 18 years now, always on the consultancy side. So originally I had a master's in neuroscience and molecular cell biology, and gradually sort of, lab-based work was never really my thing. But once I found consultancy, I think that really, I really enjoyed that. And over the years, I've sort of moved through those market access deliverables from working on global value dossiers and HTA submissions and writing up modelling reports and things, but then sort of segued later on into payer insight and more of the strategy, and more recently into commercial strategy. And that's really what I enjoy the most. So Fingerpost actually started off with me freelancing in 2015. In 2019, decided to move that into an agency model so that we could focus on strategy. And it's through that journey that we've been really focusing on the highest areas of unmet need. And that's where it's taken us to those early commercial decision support areas with biotech and small pharmaceutical companies. And that's where we primarily focus there. We do also work on launch excellence for small to mid-sized, sort of mid-cap pharmaceutical companies as well. So we get to see that sort of journey through the asset. But the main thing is focusing on the area of strategy where there might be the highest unmet need because of lack of experience and things like that. So that's sort of me and Fingerpost together there as an intro.
Exactly. Perfect. No, I think that's very helpful. I mean, it shows as well that let's say that you will bring, or you bring generally, I think, a lot of experience also from different angles and from different types of companies probably with you. But I think we can directly jump now a bit into the kind of topic, right? I mean, I said earlier, we want to speak about early market access, but I mean, a lot of times, especially when I speak with early kind of companies or companies which are, let's say, in a kind of more earlier life cycle within their product stage, a lot of people basically come rather back like early consideration of market access instead of we need a plan or we need to include it properly. So what would you basically see as a consideration of market access when planning for commercialization in the future, especially for those, let's say, typical companies we have just spoken about?
Yeah, exactly. And I think it's probably worth sort of going back a little bit and talking about what we mean by market access, because there are so many wide definitions out there. And one agency calling themselves a market access agency might be delivering very different work to another. So in this context, for us, market access is more about the mission behind patient access. If the goal is patient access, which it should be for everybody with every asset, then the mission is market access. How do we get that medicine or treatment or device available so that patients can receive that treatment? So that's sort of what we mean by market access. And when we're sort of talking about the early market access commercialization, we are thinking much more sort of work that is aligned with that commercial strategy piece. So some people do bucket it as the commercial strategy, and market access is a key component of that. You know, I know everybody's kind of familiar with that regulatory hurdle and what's required there, but regulatory isn't the same as access. That's the permission to launch a product, but access is actually the how do you then go ahead and get that to patients. And it's answering key questions like, you know, how is it going to be funded? Who are the key stakeholders involved? Who's paying for it at the end of the day? How much are they going to pay for this? You know, it's all about that commercialization piece, thinking of the end in mind. I think we often refer to that sort of end stage, you know, but thinking about that early enough that you have the chance to influence those decisions along the way. And I think when we talk about early and how early and things like that, you know, there's no such thing as too early in our minds. I think we typically start sort of as a product enters the clinical phase, clinical development phases. So, but we have done some work preclinical to help our clients sort of align and think about where they're going. We're really trying to map that route out for those clients and help them understand what the opportunity is with each asset, and also the risks and the hurdles and the challenges. Mm. So I think going back to that point of how early as well, we're thinking very much early enough to be able to influence key decisions along the route, key milestones, design of the pivotal trials, setting assumptions around the potential pricing opportunity. And then that also feeds back into how much are you investing in the asset? Where are you spending that investment, and making sure that you're maximizing that money and the funding, which we know is quite limited for companies in those early funding rounds.
Yeah, exactly. I think towards the end, I think you were also touching base an important question, which I as well receive a lot of times, especially from very early kind of companies, right? So a lot of those basically come back and just simply say, we understand that this might get more important, especially when we plan for launch, but launch might be quite far away. I mean, if we think about, let's say, pharmaceutical ingredients, that is maybe 5, 6, 7, even longer or more years away from now. With MedTech, it's maybe a bit shorter, but still, it might still be 2, 3 years from now, right? And as he said, there's only limited budget, limited money available, meaning how important is the early piece of it? Or is it not at the point, you know, we just need to do it before launch in order to at least, let's say, come up with a decent kind of strategy? I mean, what is your opinion on that one?
I think also there are different levels of the market access and layers that you need to go into, but you've got to be considering it earlier, because if you miss your key milestones, you're creating extra cost and delaying that access further down the line. And as we know now, that time to access is actually getting shorter since sort of policy changes and the introduction of JCA and things like that, certain, oncology and rare disease assets to start with, at least, you know, that hurdle is now getting closer to the regulatory side of things. You've got to be planning both at the same time. And then with certain assets where you might have that opportunity for early access and launching potentially with phase 2 data, again, you're not thinking quite as far away as you think. You know, some companies coming in with phase 1, phase/2 trials, you know, you're starting to build some of that evidence quite early on. So you want to make sure that everything, all that evidence generation plan has considered the access requirements. And then you're building in the right outcomes data. And later on, that will then prevent the need to go and run additional studies or try and acquire the right data at a late stage, which again would push back that hurdle for access. The key thing is you want to get the product to the market as quick as possible, because the longer you are developing it without generating revenue, obviously the harder it's going to be to achieve those return on investment. And as we all know as well, patents only last so long. So although it seems like a long way away, by the time you get to market, if you've got 10 years, you're probably doing quite well there.
Yeah, exactly. No, I agree. And I think for me, the important point here is the evidence generation plan, right? A lot of people basically think about market access, which is just around the payers, which is far away, which is maybe around the price, where some people, especially maybe if they're not coming from a commercial background, right, just think it's somewhere in the future important. They can at least understand this one, right? But at the end of the day, I mean, I think you mentioned that as well beforehand. How is it being funded? Who pays for it and how much? The how much is basically pretty much linked to the evidence generation, right? So if you don't have the right endpoint, for example, meaning you measure the wrong thing, payers are just not willing to pay as much as you maybe wanted to have. This might again fall back not only to patient access, right? But maybe even to your investors, even if you have your own money, right? And just one investor, or if you have an exit strategy, whatever it is, right? You need to make sure that ultimately the access strategy is linked to the evidence generation package, which is ultimately finally linked to the price. And so that's all combined with each other, right? So it's not independent.
Exactly. Yeah, it all links into that price. And you've got to be launching at the maximum achievable price, because it's only going to go down the price. It's very difficult to get it go up again. So you've got to be building that so that you're going to be in a really strong negotiating position, essentially, when you get there. And like you say, if you've captured the wrong outcomes data because you've focused on the wrong endpoints for payers or against the wrong comparator, etc. There's too much uncertainty for the payers. They can't understand, they can't see the value clearly, and therefore they are taking a risk. Mm-hmm. And we're aware that healthcare systems have limited money. Yeah. Each year, the new products entering the market and the cost behind those products is growing at a greater rate than the size of those budgets. Mm-hmm. So if they are reimbursing something, what are they not reimbursing, and how are they making those decisions? Over time, the decisions get harder and harder. We need to reduce that uncertainty and make it as easy as possible for a payer or a payer system to see the difference and the value that the new treatment's adding over what is currently used to treat patients with. So yeah, I completely agree. That evidence generation plan, getting that right, is critical early on.
Yeah, no, I agree with you. Maybe moving a bit further, because we have now a couple of different items we have already called out, right? Like pricing, evidence generation, commercialization, all of those kind of things. But it's more going into like an integrated strategy, right? How would you explain that to somebody in an early stage who again, maybe does not have a commercial background? Firstly, what does it really mean? And why is it still important to kind of finally have a really commercially viable product at the end of the day, right? Because a lot of times, at least my experience, and not everybody, right? But a lot of times, especially if they're not coming from such a background, they're focusing on developing the product, which is important, of course. But it's not the only, or maybe put it that way, it's not their only responsibility at the end of the day, right? Because ultimately they want to have a product towards the end of the day.
Yeah, exactly. I mean, yeah, obviously we've got the patient, and getting it right for the patient is key. I mean, if you're looking at the sort of worst case scenario, if you don't get it wrong, and there is no way by the time we get to commercialization to make that return on investment, the product in theory could be costing more than you're able to achieve. And obviously that's not viable. We see this every so often. The companies have to withdraw products from the market because they cannot make the numbers work. We sometimes get pulled into these kind of discussions as well. And in fact, we have one at the moment where we're going through this process and trying to help them to understand where they could potentially achieve a slightly higher price, because otherwise they can't produce, especially when you come to those cell and gene therapy, they're very expensive to manufacture. And if you can't cover the costs, you can't manufacture it, and then the patients can't receive it. So that's sort of the worst case scenario, that if you get the commercialization wrong, you can't get the product to patients. And it's such a shame when you see potentially great products that can make a difference to patients not being able to get to market, essentially. Or you see products that may launch in a couple of markets. What do you do then? If you're in a country where you can't get hold of that product, but it's almost even worse to be able to see in Germany or the US they can get this product, but in the UK we can't have it. And it might be the life-saving treatment. Yeah, so that's, for me, that's the sort of the driving force behind getting it right. There are lots of little nuances between that. And one of the other things is obviously setting expectations. By doing this work early, you're able to set expectations with your stakeholders throughout that journey. So, by the time you get to market, you're not going to get a negative reaction from the financial markets and things like that during the development through readouts and so on. So, yeah, making sure that journey is clear, I think, is important.
Yeah, no, I agree. I mean, you have already touched base quite a bit on, let's say, common challenges and pitfalls if, let's say, companies do not really consider, as we said it earlier, with market access in the early stages of life cycle. Could you maybe further elaborate as well a bit how these kind of pitfalls, or the other way, obviously, around, if you would, let's say, plan it accordingly, let's say, early enough, could impact clinical development, pricing, and obviously then overall market access, maybe as well, including regulatory plus, as you have defined it, patient access?
I think thinking about how, sort of taking the other stance, if you like, doing it the right way early on and how that can help. We're working with a client at the moment that has various assets in different stages of development. And some of the assets are closer to launch, and they haven't had this plan in place early on. And it's very difficult now. The options that are left to be able to achieve the revenues that they want to achieve, or to be able to get it to patients, are a lot slimmer. Whereas the earlier assets that we're working on, we're able to influence quite early by building that plan and making sure that they have really clear milestones that they're focused on, what they're trying to hit with each one, and the direction. So, for example, simple case, we're looking with an orphan drug, high unmet need, the potential for early access. We know now we've got to start to build the peer-reviewed publications that will be needed to achieve that access. The other thing, and I think this relates to the work that we do together, Stefan, is when we bring in that local expertise and insight early. So obviously, Fingerpost, we focus much more on building a global strategy, which is informed by the local strategy. So then by the time we do get to the markets locally, you have got the options there still. We're not sort of floating a strategy that could not work in Germany or the UK or the US or France. We've considered this early. So making sure that plan has been integrated early and moves through. Then when you get to that point, well, first of all, if you're an exiting company, you're in a strong position for negotiating with potential partner or through an acquisition. So your deal-making position is a lot stronger. And for that company, it's going to be a lot easier because the investment is a lot clearer to them. The return on what they need to do to get that return on investment is a lot clearer. I think probably we've worked a little bit on the buy side with advising on, running a few market access reviews to understand the commercialization opportunities behind assets. And we're really trying to help that company understand what the probability will be for them of achieving their target threshold, their threshold revenue, revenues. So, when we're looking through, we're analysing lots of different factors. Are they going to be able to achieve a higher price? Are they going for volume? Where is the opportunity here? What scenarios are we playing with? Who are the competitive treatments? How will it fit with those other treatments? And then sort of mapping out from that, okay, if you're aiming for whatever millions of peak revenue targets per year, there is a 50% chance of hitting it with this scenario, 20% chance of hitting it with this scenario, and so on. So the more information we have and the more careful thought that's been put into that plan early on, the easier that is. The worst thing in that situation is we come back and say, well, yeah, this can be successful, but you're going to have to run another trial because you need these data. that's another cost on top of purchasing the asset. So, that's bringing that negotiating position down straight away. And then when you get to the commercialization, it's a similar sort of benchmark with payers. This time, like we said before, you reduce the uncertainty. So the more evidence you have, the clearer, the easier it is, and the lower certainty regarding how this treatment is going to add value to patients. That's going to be your driving negotiating factor then, where you can potentially, if you can show obviously a clear improvement in value, then you're going to be able to get a better price. If you can't prove that it is going to be significantly better than standard of care, then you can't. You're benchmarked to the standard of care. So it's So that's sort of just an example anyway of how you can be improving your negotiating position at each stage.
Exactly. Yeah, no, I fully agree. I mean, and I think the interesting thing here is probably especially that you have also brought up, let's say, two different directions. I mean, one is, let's say, kind of exit / the impact on investors, whatever they look like, right? And the other one is if you as a company really commercialize the product on your own, right? And it has different impacts. And I think I also like the point when you just said as well a bit earlier, it's also around expectation management. And obviously that goes into all of different directions. I mean, trying to make that, let's say, more concept in a way, what we have spoken about, market access, consider it, think about it, strategize it, whatever, make that probably a bit more tangible, especially for those early stage companies. How would you foresee, let's say, different functions within also those early stage companies rather work together in order to really ensure that, let's say, early market access is effectively, especially integrated? I mean, how could that work from a team's perspective? What are your experiences / recommendations for such a kind of question?
Yeah, absolutely. And thinking early stage companies, and especially if your goal is not to commercialize, these companies are not going to have a market access expert. What we see most often is you may have somebody with a medical background or marketing background or regulatory background that has worked in a bigger pharmaceutical company and delivered, worked alongside market access colleagues in the past. So they know that there is a need for this service, but they're not the experts. And this is why I think consulting works really well at that level, because you just sort of pay for what you need. You're not paying for another person or a contractor. In this case, you don't need that early on. You just need guiding in the right direction, a little bit of research here, a little bit of validation there, throughout the strategy. Like we say, we reach out to you guys. Can you just advise us what the position would be in Germany for this asset? That's it at this point. Later on, we're going to need a full strategy for Germany to launch in Germany. But this first point, is this an opportunity? What does that look like? And starting to map out early. So what we do when we're working as the sort of fractional market access advisor, I suppose at that early stage, it's really more of a commercial function. So it's more like the chief commercial officer role. But we are working with all sorts of stakeholders. We are working with their regulatory stakeholders. And again, they might be using a consultancy for that work as well. We're working with the chief financial officer at times, the CEO, and the CMO, whoever, chief technology officer or chief medical officer who's leading that side of things. So, very early on, we know that everybody's wearing a lot of hats. We're working with C-suite. We're trying to help inform the leaders of the business. Then I think is the later on stages, you tend to have more roles emerging. And so you're working with a broader set of stakeholders at that point, and the bigger the company as well. And by the time you get to sort of that launch stage for those commercialization companies, you're working very niche within market access teams by that point, or within a regional market access group and helping them to understand the local requirements.
Yeah, that makes a lot of sense. Absolutely. I think that's I think very helpful. And we're already getting towards the end of the discussion. I would like to end with a bit of a more open question. I mean, what are your hopes for maybe 2030? So generally for the future, but maybe take something more tangible by around 2030, in around 5 years' time, of with early stage healthcare companies. I mean, what is your hope how they would react, move, or do basically when you compare it to maybe some of the companies you currently see, which doesn't mean that they do everything wrong, right? It's more, and it's a lot of times a lot of, let's say, understandable with limited budgets, with the background and everything. I think that that's all clear, but I think it's more, what would be your vision for 2030 for those kind of early stage companies when it comes to maybe take a broad commercial planning?
Yeah, absolutely. I mean, at the moment, we know big pharma, deep pockets, a lot of resources. They bring in a lot of access, and their early commercial planning is robust. What I'd like to be able to get us to in 2030 is that sort of planning accessible to smaller companies with limited funding. And one of the ways we are looking at that is how can we offer, sort of bring down the cost of consulting services? How can we offer smart, lean solutions, incorporate technologies and AI to help us, so sort of focus our expertise in the right areas, rather than spending many hours trying to find information, for example. If AI is able to provide that information for us, we're then spending our time to analyze and interpret and give meaning behind those data. So sort of little solutions like that, I'm hoping will then, by 2030, make that sort of early commercial planning more accessible to more companies with those small budgets at earlier stages. And through sort of educating as well, we're hoping that, at the moment, you don't know what you don't know. And we're working with a lot of C-suite level people who have not been involved with market access before. They don't even know about it as a function. So we are sort of on a journey as well to help educate and build awareness around what it is, how it helps, and why it's important, essentially. So, and I have to say, going to the different partnering conferences, we're starting to see these themes, sort of this voice get louder and louder. Even within the last 2 years, there is much more awareness out there now of how you have to plan this. And it may be linked already to that tighter funding and slightly more discerning investor than in previous years that now wants to, they're asking for this sort of planning to happen at an earlier stage. So I think overall, by 2030, it would be lovely if, regardless of whether you're big pharma or small pharma, you have the same opportunity to develop an asset. And if you want to go down that journey, to commercialize as well.
Perfect. Very good. Catherine, thanks a lot for your insights and for your thoughts and for your outlook as well for the future. Thank you again for everything.
Oh, thank you, Stefan. It's been a pleasure.
Great discussion today with Catherine Bacon on early market access in healthcare. I think very important is quite clearly not to, let's say, increase fears of not being successful, but rather turning that around and just simply say there are services, there are experienced people, there are tools available which can help you in even getting more successful from a commercial perspective. And that commercial successful point can be anything. It could be an exit, but it could also be the commercialization of the product, of the asset directly by the company to the market. Why is it important? Catherine has mentioned it briefly, because payers would finally pay, obviously, for the product whenever it's being available on the market. Those payers could be different ones. It could be healthcare systems like NHS systems in the UK, for example, but also individual health insurance companies like, for example, in Switzerland, Germany, or in the US. The common thing for planning is obviously that companies would need to understand the requirements, the needs, the requests by those different payers, what they want to see, in order then to pay a given amount of money. And that amount of money, the willingness to pay, is obviously then also very much the important consideration for the company, for the valuation, for example, of the company, and obviously as well for the business planning. The important point here is then, as I said as well earlier, evidence generation, the evidence generation plan, which is helping to make then the right kind of clinical trials with the right endpoints, with the right comparators, for example, in order to fulfill these requirements with the payers. Lastly, important also here, it's not that every time the hundreds of thousands of euros project with service providers would need to be done. A lot of times already as well, artificial intelligences are available in order to help, at least at that early stages, to understand what payers want and how, for example, the clinical trial package could potentially be seen by payers. Very briefly here, a quick ad, obviously, we have as well, besides different AIs, Max Insights, which is especially helping such kind of questions to be answered in a very fast way with our additional expertise from a consultancy perspective. That was an episode of MAP, the Market Access podcast provided by Mars Market Access and Pricing Strategy, which is your healthcare consultancy in the German-speaking markets. MAP is available every second week with a new episode, so watch out. And in case you might have questions, contact me directly and or visit our website on www.marketaccess-pricingstrategy.de.